Sudden facial palsy has a few main causes. I think of it as being able to be divided into about 4 categories. The first one is a reactivation of the herpes simplex virus that causes canker sores. The second is a reactivation of the varicella zoster virus that causes chickenpox. The third is a reactivation of the varicella zoster virus that causes chickenpox, but does not produce the characteristic rash that we think of with that condition called Rmsy Hunt syndrome, and therefore often clouds the pictures for people who are trying to treat the condition. And the fourth one is other causes, the primary of which is Lyme disease or exposure to a bacterial infection. So differentiating the category of exactly what the cause of facial paralysis is has been notoriously difficult and really clinically very challenging for most providers, which is why this term of Bell's palsy has taken hold and exists, because it just is a catch-all term for anybody who has facial paralysis. We don't know why. But the reality is there is a reason, we just don't know why that reason is. And there have been some studies that have really tried to tease out what percentage of these cases are coming from each of those 4 things that I mentioned. At the end of the day, we believe that about 55% of these patients are probably experiencing facial paralysis from herpes simplex virus reactivation. That's the canker sore virus. And those patients are likely to have a better recovery. But based on other studies that have been done, there are probably about 40 to 45% of patients who are experiencing a reactivation of the chickenpox virus. And we know from the data on the chickenpox reactivations where there is actual shingles that's visible with the rash and the vesicles that are known and associated with that condition called Rmsy Hunt syndrome, that those people have a much worse outcome. The tricky part is we think that about 2/3 of the people who have a reactivation from the chickenpox virus don't ever get that rash because they present to the doctor early enough to get the treatment that actually suppresses this onset of the rash. And so they're treated in this Bell's palsy category, not really being treated as a Rmsy Hunt syndrome patient, therefore not really being considered to be a high-risk group, even though they are because they've gotten the treatment early on. And that's one of the groups I feel like we have the most opportunity in, because if you have a patient where they're having any significant pain, any severe symptoms that are in addition to the facial palsy, dizziness, hearing issues, ringing in the ears, that's associated with the facial palsy, that are kind of classically associated with that chickenpox reactivation, the zoster version, those patients probably need more aggressive therapy, at the minimum more antivirals than they're getting.